There's nothing you can give for pain. There's nothing you can do for oxygen. There's nothing you can do. But just watch them just dwindle away is the most horrific memory I'll carry with me forever.
Welcome back. That clip was from a special report we did a year ago inside the ICU unit at Jackson Memorial Hospital. At the time, we asked one of the nurses, Daphne Stewart, to document her day and talk to our fellow nurses.
How you all doing? I'll catch up with you all later when you have a minute.
My anxiety was through the roof for an entire 12 hours. I mean, at one point I actually cried in the bathroom from how tense I was.
With the new Delta variant causing COVID cases to rise again, I spoke to Daphne this week, along with her fellow ICU nurse, Grace Meatley, and the head of the Nurses Union, SEIU 1991's, Martha Baker. Tell me what you're experiencing now. We saw how tired and how frustrated you were then. What are you feeling today?
Well, you know, obviously, since we have a vaccine now and a lot of us are vaccinated, I don't have the same level of fear, but still, it's just very disheartening to see the patients that's, coming in now and that possibly, in my mind, might not have to be there because most of the patients we're seeing, if not all of them that I've seen, are not vaccinated that's coming in and being exposed. And the thought of having to go anywhere near what we went through before is very, very, it's still frightening to me.
The thought of having to go back to that system where you're that last connection, that conduit between them and their families, either holding up a phone so their family members can speak to them, that's got to be something that you probably hoped would never return.
Exactly. It's that just knowing what we went through and that, we will be for a lot of them, the last person they see and having to step in and be there for them. So yes, it is. It's very disheartening to see that the numbers are going back up, and the thought of it, like I said, is very disheartening to me. What I see that's going on now, and the numbers going up, and we don't have the same level of fear, but still, it's a sadness surrounding it.
So, Grace, talk to me a little bit. Tell me about the types of patients that you're seeing in the ICU now.
The types of patients we're seeing in the ICU now are patients who are younger. Last time around, we had an older population. We're seeing younger patients now who are a lot sicker and they're dying faster. So those are the challenges that we're meeting at this point.
I understand that you actually had an entire family come in to the hospital with COVID. Can you talk to me a little bit about that?
Yeah, there are situations where we've had multiple family members come in the hospital with COVID, and it's unfortunate where sometimes not everyone makes it out. Sometimes, family members die, and, it's left with maybe one or two people who've survived COVID, and it's just very disheartening and sad. And another trend that we are seeing is a lot of the patients we're seeing now, maybe 90% or more, are patients who've not been vaccinated. And it's unfortunate that the vaccine is available for everyone to get. And, people are regretting not getting the vaccine, and sometimes it's just too late, which is unfortunate.
It's my understanding, like, you had a family of 3 or 4 people come in, 2 of them passed, one survived, and just that process, that's got to be difficult, just the emotional strain on that person who survives in a situation like that. Can you talk about that at all?
Yeah, it's very sad, it's to be the person who survived that, and especially knowing that the vaccine was available, and as a family you chose not to get the vaccine. So it's just something that that family member unfortunately has to live with.
Martha, let me come back to you. 58% of the entire staff has been vaccinated, but when it comes to, let's see,
Yeah.
67%.
Nurses and doctors have gone, yeah, our doctors are at like 97%, our nurses are at like 67%. Our pharmacists and others are up there in the 70s and 80s. But overall, with all the 13,000 employees at Jackson, only 58% of the entire staff is vaccinated, which is, it's a bit embarrassing. 73% of Miami-Dade County, you would think, having been inside and see people dying, that all of us on the inside would be taking the shot. And this is the disheartening part that both Daphne and Grace have talked about. The shots available. I grew up in a time when I've, had uncles that had polio and then got the vaccine. Nobody fought those vaccines of the past. Everybody welcomed them. And this one just is a lot of reasons, but seems to be politically charged. A lot of misinformation. It's embarrassing. And you would expect those of us on the inside would, be firsthand pushing and promoting the shot. But there are people, and it's all ranges. People are afraid, want to see more people get it, see what happens. But to me, the risk benefits are just so clear. As Grace has said, I mean, people are dying now. This new variant, they're dying faster and a higher percentage than ever before. Grace and Daphne have both talked about how tired the nursing staff is, and all the caregivers are just tired. Grace has talked about how it's like a football team moving these patients, trying to turn them on their belly so they can oxygenate. And it's backbreaking work. It's stressful. It's emotionally draining, and we know better and we can do better. And others are saying, no, I'm not taking it. And that's like, who's paying the price? Obviously, those that are dying are paying the ultimate price, but the caregivers on the inside are having to react, to this misinformation on the outside and deal with this stress all over again. It's just nonsense.
But I come back to the notion of 1 out of 3 of your nurses are not vaccinated. Why do you think that is, Martha?
I think it's all over the place. I think I think politics is probably the number one. I've had people say they're reading it on the internet that the CEO of Pfizer didn't take the shot. And, then someone else will say, yeah, he did. He took both. People are just believing this nonsense.
I was going to ask Daphne, have you had those conversations? Have you talked to folks who won't get vaccinated and tried to have a conversation as to why?
Yes, I've had those conversations, and to be honest, it leaves me speechless that in today's time, but what I tell people and those people and my coworkers that have not been vaccinated, or those is that, just go by what we've seen, what we've noticed. That people were dying by the hundreds of thousands of people have died. And we saw that. And as soon as the vaccine came on board and we started taking it, we noticed a difference. So don't go by, some of the information, just go by what we experienced ourselves. We felt the difference. And, it just goes back to saying it's very frustrating to me sometimes and disheartening.
Grace, have you had those conversations as well with coworkers?
Yes, I've had those conversations, and I'm saying we're healthcare workers and we believe in science. And the science, like Daphne has shown, and the statistics shows that the vaccines, people taking the vaccine lowered the level of the patients coming in the hospital. So if you're a nurse or a healthcare worker and you believe in science, the science is the proof that the only way of us getting through this pandemic is by having a higher percentage of people vaccinated.
Should Jackson require all employees to be vaccinated if they want to continue to work at Jackson?
Well, I've talked to actually Don Steigman, who's the CEO of Jackson, about this. I personally would be in favor of mandation. Holy Cross Hospital has started, they're going to mandate it as of September. Our board of our union has talked about this. Right now it's experimental, and a lot of people believe, the leadership of Jackson and the leadership of our union, that it's probably hard to mandate it when it's still considered experimental. I'm hoping the FDA will approve it, and I hope more people and more organizations, and I've heard probably the private sector is going to be easier to lead on this, will mandate. It's frustrating though that, you know, we've got educated coworkers, as Grace said, that believe in science and follow science and are, you know, operate every day in our hospitals based on scientific research and data, that now we're fighting this. We should be promoting this.
Daphne, you know, working the floors, is there a moment in the recent history, the last few weeks, that sort of sticks with you?
Well, you know, I was out for a while, like I said, because of the death of my father. And when I went back to work, you know, the first set of patients I had was a couple of COVID patients. And they were younger than what I had the last time that I took care of the COVID patients. And being in the room, being gowned up, feeling, you know, like I'm in the bubble again, is here we go again. You know, and you know, I just, it's just, you know, there are no words, Jim. I don't know what we can say. My patients wasn't vaccinated that had it.
You asked Daphne what was the most jarring situation, and for us it was recent. We had our youngest, as far as I'm concerned, youngest person die from COVID in our unit. I came in the morning to take care of the post-mortem care, and that person was less than half my age. So it was just sad looking at this person who haven't really, you know, started living life yet, and just to see that body there, and it was very emotional for the staff to see such a young person lose their life from COVID, and that person, of course, was not vaccinated. So I think that was the saddest and the most jarring thing, was how young the person was. That's so much younger than even my age.
We'll be right back.